Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank everyone for tuning in. If you haven't already, please like and subscribe so you can be sure to get the latest episodes as they come out.
And if you have any topics or questions you'd like us to answer, you can submit those at sgmc.org/podcast.
Yep. And today we are here with Norma Brown, who is a registered nurse at SGMC Health, but is also a big proponent of our diabetes education program. So, Norma, what brings you in today?
So I wanted to talk a little bit about how SGMC Health works with the patients with diabetes in our community. SGMC has been a big proponent of diabetes education, and diabetes is a huge problem in our country, but certainly in the South, where we like to fry everything. Mm-hmm. And so we like sweet tea. Mm-hmm. But I just wanted to touch base and just let people know that our program is out here and kind of what's involved in that.
Okay. Well, first off, let's talk a little bit about you and how you got into diabetes education. So tell us a little bit about your background and what kind of, how you became so passionate about diabetes.
Okay. So I've been a nurse for 38 years, which blows my mind. But I often introduce myself as, I'm Norma Brown, and I've been a nurse since God was young, and in diabetes since Adam was a lad. So I started out in critical care, did that for 12 or 13 years, and then kind of just went PRN and just went to different areas, and I fell into the diabetes realm, and I just really, really enjoyed that and have just stayed for one reason or another. I've just managed to continue to stay in that area. And I think it's good to have a specialization as you get older. But yeah, so that's kind of my background.
Gotcha. Well, let's just, for all the people that don't know what diabetes is, if you're not aware, we're kind of aware because it is so prevalent in our area. Mm-hmm. But tell us just, what is diabetes?
So diabetes is when the body is not able to either produce insulin or the body does not use the insulin correctly. So with type 1 diabetes, which is about 10% of our population, it's the pancreas where the insulin is made in the body just basically stops making the insulin. They think that it's autoimmune in nature. It tends to be diagnosed with people that are younger. You hear a lot of times of children, but usually before age 30. But that being said, there is no black and white hard line as far as that goes, because we see people that are 40 and 50 that wind up with type 1. Now, type 2, which is our largest body, pardon the pun, of patients, that's like the other 90%, their body stops using the insulin correctly. So a lot of times it's somewhat weight related. Over time, having diabetes, it is a progressive disease state. And so sometimes people can manage it with diet and exercise, use a little bit, shed some weight, and just kind of pick up healthier habits. And then because it is a progressive state, sometimes you have to take pills and sometimes you have to take insulin because your body just is not making the amount. But it doesn't mean that you've turned into type 1. It just means that you're insulin requiring in type 2.
Is that like insulin resistant? I hear that a lot.
Yes, insulin resistance.
Is that the type 2? Okay.
Mm-hmm.
And it gets worse over time.
It can. Mm-hmm.
So is there a huge benefit, which I'm assuming there is, in early diagnosis?
Absolutely. So a lot of times people don't realize that, and especially with type 2, a lot of people, it's kind of a gradual thing, and they'll have increased thirst. Well, it's hot outside and I've been working outside, so I'm drinking, and then increased urination. So, well, I've been drinking so much, so it's, I'm going to the bathroom more. And then insatiable hunger, like right after you eat that burger. I'm still hungry. So those are kind of classic red flag signs of diabetes. Now, the earlier you can be diagnosed, the faster that we can work on some of the easy things. I say easy, but diet and exercise. I don't expect people to go run a marathon. And I don't think that you have to live a really hardcore, strict life as far as food goes. But you have to adapt a little bit. If you're drinking a 6-pack of Coke, we're going to have to talk.
Yeah.
So, but the earlier that we can get on it, the quicker we can kind of turn that ship around and keep the bad things, the hardcore complications from happening.
So you educate patients in the hospital. Can you tell us a little bit about your role and how that works?
Yeah, so there's 3 educators. There's myself and then Leanne and Stacy. And we do both inpatient and outpatient education. So there's kind of like 2 roads. So inpatient, we see folks who might be newly diagnosed, people who maybe are they came in kind of sick and they're going to start on insulin. We see from pediatrics to gestational, the pregnant mamas, and all the way to geriatrics. So we see the spectrum of patients. Other things like if they've come in for something, it can be kind of a focused education when it's inpatient. So maybe they came in really sick and didn't know what to do with themselves and they have diabetes. We go over kind of a sick day guideline or we go over foot care. So it can be stuff like that. The outpatient aspect is 3 very intense classes, and we have them in the morning, the afternoon, and the evening every month. Well, we won't in December because it's Christmas and nobody comes. But
they're too busy eating that.
They're too
food.
busy, exactly.
They don't want to be guilt tripped.
That kind of Thanksgiving, that's kind of a sketchy
We'll pick back up in January.
Yeah, but the classes are 2.5 and 3 hours long. And everyone who comes to them goes, why didn't I know this?
Yeah.
Why haven't, and we'll get people that have had diabetes for 20 and 30 years and they come and they're like, but it's not information that you're born with.
Right, yeah.
You have to actually seek it out.
Yeah.
And, you do what you do until you know better, and we try to help you know better.
Yeah. And, I feel like you don't really see a lot of education even out in just like social, any kind of, I don't see anything about it, but maybe it's because I don't have diabetes and it's not targeting me in my feed. But you see like weight loss stuff and how to lose weight, different nutritional fads and stuff, but you don't really see anything about like, hey, do you have this diabetes? Let me help you be, more better at that.
Right. Well, now that you've talked about it, it will come up on your
we'll
feed.
see. Yeah, we'll see. I'll test
They're
them
always
out.
listening.
Okay.
Yeah, so the outpatient, we also have classes for people who are Medicare eligible. They can come for 2 hours of education each year, and just kind of like a shot in the arm. Juice up. This is the latest, the greatest, the newest, and try to help them out with that. And we have gestational classes, and we also have classes for people who are gearing up for insulin pump. So we have intensive insulin and carbohydrate counting. So that kind of gets people started towards that path of wearing an insulin pump.
How do you combat like lifestyle change? What are your tips for
Yeah.
that? Because I feel like that could be very hard when
It can be.
having to make dramatic changes, or maybe they're just starting with little
Well,
ones.
that's the thing. It's you kind of want to try to meet you halfway. And like I said, if you're drinking a 6-pack of Coke, we got to cut that way back.
Mm-hmm.
Cut down to 2 a day, and then eventually 1 a day. The biggest thing that I could tell a patient or anyone who's newly diagnosed is get the sugar out of your drinks. And I really, within the diabetes educator world, they really want you to get away from diet sodas as well.
Yeah.
So, water, I drink Crystal Light. So there's other options out there. it's just sometimes, that
not as
sweet
familiar,
tea,
yeah.
let's do half and half for a while, and then let's peel it back to unsweetened, and you can sweeten it with artificial sweetener.
Yeah, that's what.
I don't think people realize how much sugar they're drinking.
That's what I
Oh,
was
they
gonna say.
don't.
When
They
we had
don't.
Dr. Pasula on that time, that was one of his major tips for not, keeping your caloric intake down was pay attention to what's in those drinks because
Juice.
that's often
Juice is
hidden in
another
there.
one.
Yeah. People
Yeah.
think juice is good for you.
They think
because
it's healthy,
it's
but I'd
fruit.
rather you eat the apple than drink the juice.
Yeah.
Because that's like mainlining, when you drink juice.
Yeah.
So, eat the orange or the tangerine, but don't.
You still can
eat
get
the
a
juice.
little bit of that taste, a little bit of that
Yeah.
sugar rush.
Someone who's hardcore
but-
wanting to get, I'm drinking my, you can now get sugar free,
Right, yeah,
which
there's
is pretty
lots more
cool.
options.
And then, I'll say, well, you know what, put so much in, and then fill the rest up with water and ice, and you're still getting that flavor and that satisfaction, but you're not getting that big jolt.
It is very addictive.
It is.
I like a Coke every now and then.
Yeah, I haven't drank sodas in 15 years. I tried one about I don't know 7 or 8 years ago, and I was like, oh my God, I can't believe. I mean, I was like a Diet Coke fiend, but
Well, the fact that they use Coca-Cola to clean your the corrosion underneath the hood of your car,
That means
is
it's
Get the
kind
rust
of a little
off.
worrisome.
It's
But yeah,
really
I still
good.
drink one every now and then.
That means it's good for you.
it's cleaning out your insides.
Yeah,
I'll
yeah.
say. Yeah, it is.
So we've talked about the drinking the sugar and the diet. What are some easy kind of exercises you kind of recommend them to start off with?
Okay, so if you've lived a sedentary lifestyle, if you're sitting there at the TV, in front of the TV, if you have TV that gives you commercials, because now you don't even get commercials,
You don't even have to
find
get up.
yourself a little break. But at the commercial break, stand up and either walk in place. Walk if you have a circle in the house, like your living room, dining room, kitchen, living room, dining, kitchen. Walk that while the commercials are on. When you would normally maybe get up and go and get something to drink, that's a really great time to do that. Other exercises, probably the best one that I can think of is being in the pool. You can either swim because you still get that resistance from the water on you, but it's so easy on the joints.
Yeah.
And, people will be like, well, I don't swim. I said, well, get in the shallow end and go back and forth. Just walk back and forth, And then resistant bands, you can find those pretty much anywhere, and they're really cheap. But the resistance bands, and then I'll tell people to get 2 cans of, corn or whatever.
That Coca-Cola.
Yeah, Coca-Cola, something with a little bit of weight on it, and just do some what I call armchair exercises where you're just lifting and that kind of thing.
Chair exercises
Yeah,
are
so
good
that's
alternative.
usually just starting off. I don't,
Yeah.
don't run a marathon.
Right.
My God, I don't expect you to do that. If you have access to, I don't even know what those things are called, the little pedal
Yeah.
things. Those are great also. So anything like that. So anything that's an improvement on what you have been doing, which is usually sitting.
Yeah.
So
Okay.
I take the stairs here.
Yeah.
And that's
I
could be a
walked up to
workout.
the 5th floor yesterday on the stairs, and I was a little out of breath when I got up there. I was a little embarrassed. But
Okay. Well, if
Go
I
for
tried, I'm 8 months pregnant. If I tried to take the stairs to the 5th floor, y'all would have to call a code blue on me.
oh, I know what I was going to say now. Don't do that. What role does the primary care provider play in diabetes? What is the most common way that people realize they have diabetes? And then what would you say is the importance of a primary care provider?
Usually they'll have those symptoms that I talked about, or I'll tell you one that a lot of people come in with is numbness and tingling in their feet. And they're like, why are my feet feeling weird like that? What is that about? And eventually they'll go to find out, or they'll find out through their, primary care, and they'll be like, oh, you have diabetes. So that's often one of the things that is, again, a red flag. But as far as the primary care, unfortunately, we do have people who like never go to the doctor, and usually at least once a week, twice a week, we have people that come in, chest pain, then they go and have a heart cath, then they go and have bypass surgery, and it's found incidentally that their blood sugars are really high and have been because we draw something called an A1C. And that A1C is like a 3-month average blood sugar. For someone with diabetes, 7 or less is what our target is. And we'll find these folks that come in that haven't been really following up with a provider, and they're, 11, 12, 14, and that's like a blood sugar around 250, 300. So you've been sitting there for a minute, if your blood sugar is running that high over the last 3 months. So you probably had it for quite some time.
Yeah, I've seen those commercials about lowering your A1C.
Yeah,
the pharmaceuticals.
Yeah. The dance with
Yeah,
Jardiance.
yeah. A1C.
Yes.
Yeah.
Okay. How do you encourage these patients? Because it sounds like, a lot of it is lifestyle change. So I know that's probably one of the hardest things for them to do if they've been living this way their whole life. How do you kind of motivate them?
Encourage them to keep being compliant.
Right.
Well,
I will say that Leanne and Stacy are awesome. They are very passionate. Mm-hmm. I am too. But they bring just a ray of sunshine into the room, and it's never judgmental. And I think that that's really important because sometimes people can be so, of course you're, I had a lady say to me, I would never have thought that you had diabetes. I said, we don't have horns, So I guess you just want to be encouraging. The ones that do come to class love it, and they always wind up coming. We do a 3-month follow-up with them, and they are just like so excited to come to that 3-month follow-up because they've been in class with 2, 3, 5 other people, and they're like, how have you done? Oh my gosh, you look like you've lost weight,
it's
like that kind of thing.
They kind of get connected.
And so we used to have a really active support group, and we're actually going to fire that back up in January. So we will be probably trying to advertise that a little bit more and to get that going. I mean, we had a really great support group, and I think that it's very important to go and learn something and be with folks that are like-minded.
Yep. I think that adds a lot of value.
Absolutely. And then there's a lot of support out there on social media. You just want to pick and choose what it is that you're listening to, because sometimes it can be, crazy town.
Right.
So, but just to kind of get that support, we can do that.
Yeah, I would think that the encouraging way would be the better, is, instead of the hard line, kind of more stern, because I'm sure that anyone that has someone kind of pointing their finger at them, they don't want to listen to them.
Yeah. And those, Leanne and Stacy have a way of making people talk. And, Stacy was in with a patient recently. This is kind of an aside, but she was in with a patient probably a couple of months ago. And she was talking with the patient, and the more she talked, she was just like, have you got food at your house? And she's like, oh, yeah. And she looked at her and she goes, have you got food in your house? And she started crying. She goes, no. And so these are the people that when you say that to them, when they're asked on, we ask all that when they're coming in there. People are embarrassed or ashamed, but there's no reason to be embarrassed or ashamed if you are going hungry. We need to solve that. So we've been trying to work with Second Harvest and helping them move patients towards where the food pantries are and that kind of thing. And we got her some food, So little things like that.
Yeah, I mean, I've heard several stories of that from different. It's things that people don't realize that we do, like the medical field, the people that are taking care and learning more about these patients and seeing other needs outside of the hospital that can be met, and then kind of going the extra mile to help make sure, because you're right, if she doesn't have access to, if whoever it was doesn't have access to food, then how can we help them make the right choices in their food, and then
Right.
they're going to end up just sick again. So it is about like that, connecting them to the important resources that can help them be healthy outside of the hospital.
Absolutely. I mean, she's going to go home from the hospital and she's going to have to try to scare up some food from somewhere. But, if she has that going home, at least she can make some soups. She can get some, and usually they have like some kind of potted meat, canned meat, something like that. It's not perfect, but you know what? When you're hungry and you need...
Yeah, I mean...
Yeah.
It's better to have access to resources for sure. I mean, and that just speaks so much to the type of people that are working on your team and that they are like truly caring about the patient.
Oh, truly.
More than just a job.
Yeah. Absolutely.
Definitely.
That makes me feel good. That's sweet.
And healthy food is hard to get a hold of if
that's
you're
a whole national issue.
if
I feel
you're
like.
income restricted.
If you ever want to get a real shock about fast food, watch Super Size Me. You can see it on Netflix, and that is shocking what this guy goes through. He challenges himself, and it's fascinating. But
Yeah, I think I watched like a half of that, and then I was like,
I can't watch the rest of it.
Yeah.
That's
But it's
fascinating.
the hard reality. I mean, and it is the hard reality of what our people are facing out there. And so
You can get 4 for $4. You know what I mean? Versus whatever, if you have to go and buy meat, which is really expensive. So one of the things we do in support group, or we did in support group, and we'll take it back up, is we went to Winn-Dixie one night, and we walked around and looked at labels and talked about meats and meat choices, and it was fantastic. I mean, I don't know how many people we had. I bet we had 30 head of people. It was,
it was
a
like
lot
a grocery
of
store
folks.
tour kind of
But
thing.
so we kind of toured the grocery store and talked about label reading and that kind of thing, and looked at something that said, "Oh, I'm sugar free,"
Yeah.
and then because that's
they
a
can fall
misnomer.
victim,
It is. So
And if no one's ever taught you that,
Exactly.
if no one has ever had, a discussion about it, I know what it's like to kind of grow up and not really think about that. And then you start looking at it, and you, as an adult, you're learning, oh my gosh, well, I've been eating all the wrong things, and I had no idea because that education is just not there.
it's not there.
So I think
But
it's
you're
very
here.
important.
So
Yeah, we're
that's
here.
what you're here for.
We're here. We're bustling on through
Yeah.
and doing our little part. And we are moving our education classes out to our sister hospitals in Berrien and Lanier.
Very nice.
So we're really excited about that expansion.
That is good. I know that's one of the things that also comes up on our community health needs assessment every time we do that for Lowndes and Berrien and Lanier is just awareness for diabetes and things like that. I mean, that's a common issue that is out
So
there.
yeah, I've been going and seeing the healthcare providers in those areas, and just kind of beating the door down, letting them know
Yeah.
we're here and we're going to be locally. And because it could be a chore for people to get into Valdosta.
Yeah.
It
It
is.
costs
Yeah.
money for gas, and sometimes you
Time
have to
for
wait on a
travel.
ride
Yep.
and that kind of thing. So it's a lot. Let's
The
let's go to the mountain.
The elderly
Yeah.
are not driving
Yeah.
Exactly.
that
Yeah.
far. My family and my grandmother, they live in Ray City, and my granny does not drive. So it would be a trek for her
Yeah.
to come over here if she
Yeah.
didn't have a ride.
Exactly.
So I think that's really good.
Yeah, it is. We're really excited about that growth.
What role does the patient's, family and support system play in all of this?
That's a real good question. So I think it's really important not to be judgmental and not be like, you can't have that. Get that out of here.
Yeah.
Okay. All right. You don't want to be shameful.
Yeah.
I think some of the best ways that you can support is if they're going to start walking, you know what? Get up and walk too. Ain't going to hurt you.
Right.
Right?
Yep.
If you're able, if you're in a scooter, well, scoot along slowly next to them, I mean, that's
Yeah.
just chit chat,
Yeah.
I think other things like trying to follow that same kind of meal plan, you don't want to make fried chicken and baked chicken,
Yeah.
just
That makes it hard.
adapt. And other things like, I was thinking about this, if we're going to encourage them to stop smoking. And so it's really hard to stop smoking if other people in the house are smoking. So
Yeah.
stop smoking with them. It's probably one of the better things you can do for your life.
Yeah. absolutely.
Yeah. So just that kind of support,
Yeah.
and I think it's really important not to shame them. Now, our classes can bring one support person with them. So, if you have someone who's diagnosed, a husband's diagnosed with diabetes, a wife wants to come. And sometimes they're, the chief cook, bottle washer,
Yeah, yeah.
So just whoever that is that's your support person in your life to come along, because it's information that's good to know.
Right.
So,
Yeah.
I think that's good. Yeah, it would be very difficult to break a bad habit if
yeah.
your support, your
Exactly.
spouse is
Exactly.
just still doing that right there.
For sure.
They probably don't need to be smoking either. So
Exactly.
you're right.
Think of the money you'd save, because I think like a pack of cigarettes is very expensive. I don't know, never smoked, but they're like super expensive.
Yeah, I don't know, but I'm sure with how expensive everything else is, that is
I know,
also one of
right?
the things that
Exactly.
is up there. But well, that's awesome. I'm just glad to know that this resource is here for our community.
Absolutely.
So,
Yeah.
definitely do our part to help
Yeah.
share the good news.
Yeah. If the provider is an affiliate of SGMC, they can go on Epic and just order ambulatory diabetes education.
Okay.
And if they're not, they can really, honestly, they could just call the hospital operator, say, put me through to a diabetes educator, and we'll fax the paper order for them to fill out at their provider's office. So there's lots of ways.
Very good.
Do you have any success stories that stick out in your mind of people that you've educated or?
I do. I had this fella, this is when I was working at the clinic, at the diabetes clinic, and he wanted a pump, by God. And so I worked with him, and he came in, and we had to learn how to carb count. And then within the pump, now this is a minute ago because pumps work a little bit differently now, but within the pump, you had to know how to give your insulin if the pump failed, because it is just a machine.
Yeah.
So if you had that pump failure, how much you would give to correct your blood sugar, how much insulin you would give to cover your food. And so there's these practice things, and it's like homework, And bless his heart, he didn't even know how to round up or round down.
Yeah.
So I wrote it out for him, and I worked with him and worked with him and worked with him. He come in, Miss Norma, I was like, hey, and by God, he still is on his pump and doing great.
That's
So
awesome.
that to me is just like a little, But like I was saying, we have a 3-month follow-up, and we'll see those people that have those A1Cs coming in, they're 11%, and they'll be 7 or less, and you're like, yes.
Yeah.
And they're so proud of themselves because it's not been that hard. They're just like, I just didn't know.
Right. Yeah.
Yeah. So
You
we
can't,
see
you can't
our-
fix what you don't know.
Exactly. Exactly.
That's awesome, though.
Yeah, it is. It really is.
That's great. I bet that feels really
It does.
rewarding.
It does. It's fantastic. And a lot of them are like, well, we just didn't know.
Yeah.
I just didn't know. Why wasn't I told about this class before? You
Yeah,
know?
yeah.
So it doesn't help to just say eat less and move more. That's
Right.
not
Yeah.
a plan.
Yeah. Yep.
Okay. Well, we really appreciate you
Yeah.
being here.
Thank you for having me.
This has been a really great, I think this is a really good, relevant conversation, especially for the area that we live in, like you
Absolutely.
said.
And we can put information, we'll connect it with this podcast episode about the
Yeah.
support group and
Absolutely.
the classes and stuff like that.
Yes,
So-
definitely.
That's great. Yeah.
So, we've been talking about food this whole time, so now we're going to have a little test. What is your
I got the
favorite
answer.
meal to eat here?
Okay, so I like to get a small breakfast in a cup with turkey sausage.
Okay. Oh, you
I know that.
Are
I
you
knew
sure?
that was coming.
Is that your final answer?
That's my go-to. Yeah, I knew that was
Alright.
coming.
You can't say fried chicken at this point.
No, I mean you can, but you're kind of like golly. But that's what I like to get,
sausage,
and
I
if I
gotcha.
get that in the morning, I just usually don't
Right, that
need
can
much
kinda-
of anything.
it's solid. It
at
can- it
lunch.
can
Yeah,
keep
that
you
keeps you
sustained.
going. That sticks to your ribs,
Yeah.
right?
Yeah.
And the
Okay.
breakfast is a king.
Yeah.
I like
Yeah.
the turkey sausage too. Okay.
So it's a little bit healthier, but and just a
Alright.
small one, just a small breakfast.
Yeah. Yeah.
Yep.
All right. You heard it here first. If you
Yeah.
want to get a relatively decent breakfast that is going to stick to your ribs and keep you full till after lunch, you can go for the turkey sausage instead.
Yep.
Okay, thank you to everyone for tuning in today. And if you have any questions you would like us to answer, topics you'd like to hear us discuss, you can submit those at sgmc.org/podcast.